many of you have either experienced or seen something like this on maybe your baby, maybe your friend. I'm very sure of that, my medical fans. But what are they? They look so strange on a person's ear. Is it an alien? Is it a growth? Is it cancer? Ooh, my medical fans. These are actually called helical keloids or keloids on the helix. Do you know why they're called helical keloids or keloids on the helix? Well, it is because of their location. Because this area of the ear you're seeing over here is called the helix. And you can see this growth, which is protruding over this helix, right? You can also see that it is actually in the inner part of this ear. Can you see it around the area of the helix, just below it? Can you see that? A small one there. So, my medical fans, these are called helical keloids, and they commonly occur after ear piercings. Yes. Do you know that so many of us women love piercing our ears? In fact, our mothers make sure that they pierce our ears shortly after giving birth to us. And although the keloids over here are not located over the area of the ear piercings, because those ones are usually called the lobular keloids, because this area of the ear is the area that is called the lobule. I'm sure you can see that there's a small area over this lobule that actually has a small keloid wanting to form. Maybe this patient was trying to also pierce this part of the ear, the lobule. But it is really, really interesting, isn't it, to see that the area that has been pierced actually has no keloid? Is that so? So what could have happened? What could have happened for this patient to develop this helical keloid? Can you see these keloids here? It is so interesting, isn't it? You could actually see it at the back of the ear as well. Can you see that? Still on the helix. A small part just at the back of this patient's ear. So as I said before, these helical keloids often occur after some minor trauma. Yes, these helical keloids occur usually after some minor trauma has occurred over the area. And why do we develop these? Well, we know that commonly, it's an abnormal healing response, isn't it? It is a response to abnormal healing because of some trauma, some injury over this area of the ear called the helix. So maybe this patient may have developed some form of trauma, some form of injury over this helix before this keloid, must have formed. Some trauma maybe over here near the lobule, some trauma over here, and then maybe possibly a greater trauma over the area that has this large helical keloid or helix keloid. Can you see, my medical fans, the blood vessels that are dilated? We call them dilated, enlarged over this keloid. Yes, it is commonly seen that way. When there are blood vessels over the area where a keloid has actually formed. So, should we talk more about this process that usually occurs when keloids, form? So, my medical fans, let me tell you something interesting about this, okay? Let me tell you something interesting about this. Unlike regular scars, these keloids, grow excessively from the initial wound site. As you can see over here, there must have been a wound over the helix, right? But this keloid can be seen to be extending beyond, most likely beyond the initial area of the initial wound. It is very, very possible that maybe, just maybe, the wound over this helix was actually quite small. But when the wound was healing, the abnormal healing process and the abnormal scar formation now extended beyond the level of this initial injury, thereby causing this keloid to appear larger, larger than the initial scar that it was. So interesting, right? But do you know that these keloids actually do not reduce? They don't reduce in size over time. Unless, of course, you went to the hospital and something was done about it. They do not regress naturally over time, my medical fans. And did you know that they can actually develop as short as even, 3 months to a year following the injury over this helix? And yes, as I mentioned before, they can form around the area of the earlobe, as I mentioned prior. Yep, the earlobe is the area where we commonly have our ear piercings, as I showed you. And you can see in this patient that, yep, there is something that is looking like a keloid wanting to form around very close to the earlobe, but it is more pronounced over the helix. And so, my medical fans, you see some of these patients, maybe even your baby, maybe even your relation, having this keloid even in 2 ears. Yes, if they're prone to developing keloids and there was trauma in both of the helix, both the earlobes and also the two helices, they can occur over both ears. So you tend to see it in the skin over this helix and also over the area of the cartilage, as you can see. The area of the cartilage is the area that is a bit firm, and so you see it over the skin and over the area of the cartilage, as is seen here. Now, as I mentioned, they appear sort of like rubbery, they appear firm, they appear like nodules like this. Can you see that? Can you see that? They're firm, they're rubbery, and they are like fibrous. They're like nodules, they're like nodules. Firm, sometimes flesh colored. Yes, like here, it's flesh colored, isn't it? Yes. It's the same color as her own flesh. Can you see that? But sometimes they can even vary in color. That is, sometimes these helical keloids can change, can vary. They can vary in their color. They can be commonly darker than the surrounding skin, because over here you can see that it's similar to the skin over this patient's ear, but you can commonly have it darker than the color of the patient's skin. So, are they difficult to remove? Are these helical keloids difficult to remove? They can be very difficult to remove because, yes, they often grow back. So, I've mentioned that keloids like this, you can see the enlarged blood vessels running over them. Can you see that? Can you see the enlarged blood vessels running beneath the skin? Can you see that? It's a raised scar, isn't it? The keloid is a raised scar left on the skin after a small wound has healed. And we've talked that possibly the wound over this helix was actually very small, but the keloid was growing, an abnormal scar response to the small trauma that occurred over this helix. The keloid, the scar, now overgrew beyond the initial area of the scar, even the one over this back. Can you see it? Possibly the area of the wound was just maybe a pinprick, but you can see that the abnormal scar response was occurring, has occurred beyond the initial pinprick, possibly after the wound had healed. So, as I said before, you cannot get rid of it, but yes, treatment can actually improve the way this ear will eventually look. But what kinds of treatments can you offer to this kind of patient that has these helical keloids, ear keloids? You can combine various modes of treatment because, this will improve your chances of maybe almost permanent removal of these keloids. But have you ever asked yourself, who do these ear keloids even affect? Who do these ear keloids often affect? My medical fans, do you know that anyone can get a keloid over their ear and over this helix as shown here? However, did you know that you are more likely to develop a keloid over your ear if you're black like me, if you're a black woman like me, or a black man, if you're Hispanic, if you're Asian, and as I mentioned before, if you have ear piercings? Do you have a family history of keloids? So if you have a family history of keloids, you're more prone to developing keloids. All right? So I won't be surprised if one of you watching this my live session on helical keloids or helix keloids, I will not be surprised, my medical fans, if you watching me here are actually one of the people I've mentioned just now as being prone to developing keloids. Yep, I know that you may probably be black, you may be Hispanic, you may be Asian, and maybe you have a family history of keloids or you know someone who has keloids. Have you noticed also that the person that you can see in this picture actually is a black woman? Thus reiterating and buttressing the fact that yes, we black people are more prone to developing keloids and Hispanics and Asians, generally darker skinned individuals. And my medical fans, did you know that keloids tend to occur more frequently in people, in adults, commonly, but it can occur more frequently in individuals between the ages of 10 and 30 years of age? Yes. Commonly, we don't see keloids in, individuals under the ages of 10, but we do see them occasionally in our clinics. However, yes, it's documented that we commonly see keloids within the ages of 10 and 30 years. I mean, did you know that there has been a study that has revealed a connection between the concentration of this melanin in our skin? Yeah, we are black, we are Hispanic, we are Asian because of the amount of melanin in our skin. This melanin in our skin, it has been studied to find out, hey, is there a connection between the concentration of melanin that makes us black, that makes us darker skin colored? Is there a connection between the concentration of this melanin and then the collagen density within this keloid tissue? Well, the keloid tissue has a lot of collagen in an abnormal fashion. I won't go further on that. But studies have revealed that there's a connection between the amount or the concentration of melanin in our skin and the amount and the collagen density, the thickness of collagen within this keloid tissue. My medical fans, this finding, it possibly agrees with the observation that, well, yeah, helical keloids are more commonly found in we that are African, that are Asian, that are of Hispanic descent. And, well, even though there is a connection. There is still ongoing research being conducted to gain a deeper understanding of, this particular specific relationship between the melanin, which makes us black, and the development of these helical or helix keloids, and generally keloids. But my medical fans, how do these ear keloids affect my body? How do these helical keloids or helix keloids that I'm showing you in these pictures, how do they affect your body, on your baby's body, on your relation's body, on your friend's body? Well, did you know that keloids don't actually hurt? Well, they don't hurt. Sometimes, they may itch. They may, they may feel a bit painful maybe if you touch them. Especially as they're growing, or especially if they're very large. If they're large, you may feel them being a bit itchy sometimes, or they may rub against your clothes or hit against something if they're large. And yes, then of course they'll be tender. They may become irritated, of course, if you accidentally touch them, especially if they're large like this. Or as I mentioned before, if they rub against your clothes. Of course, if you have helical keloids, you may feel self-conscious. You may feel insecure about your appearance, isn't it? Yeah. If you have something like this over your ears, over your helix, especially if there are many, if there are more than one. Look at this. There's one at the back, there's one on top, and then there's another one in front, there's another one here, and then smaller ones wanting to come out, right? So it may make you feel, insecure. They may make you feel insecure about your appearance, anxious about your appearance, because you may be scared that if people look at you, they may notice it and may look at you strangely, especially if they don't actually know what it is. And so you may experience some form of like emotional stress, isn't it? You may be anxious, you may be depressed whenever people look at your ear, whenever they see this. And that is what actually makes you come to the hospital to seek for treatment. But as I said before, hey, these ear keloids, these helical keloids, they develop slowly over time. They may take up to 3 to 12 months to actually become noticeable on your body. And yeah, they also feel different from your surrounding skin, right? They may feel sometimes hard, yes. They must sometimes feel soft or squishy. They may feel firm, as I mentioned. They may feel rubbery. Yeah, like this. This looks like it's going to be rubbery, right? Or even firm to touch. They're also shiny. Yeah, look at it. It's shiny, isn't it? It's shiny because it's tensing the skin. So yeah, they may look shiny. They may be smooth. Yeah, this is smooth, isn't it? It's smooth. It's smooth surfaced when you touch it. And then, yeah, it may be darker than your surrounding skin. Can you see that it is slightly darker on this part, over this part of the ear? You can see it's a bit darker, isn't it? This keloid looks like it's a bit darker, but some other people might say, oh no, it looks like it's the same color as her skin. It may appear just fleshy colored, So, these small ear keloids, they appear, sometimes just a quarter of an inch above your skin, like this one. You can see that it's just slightly raised above your skin, like a quarter of an inch above your skin. But massive ear keloids, the large ones, they may be larger than even the surface area of your skin, all right, of your ear, sorry. And maybe later on in this live series, I might show you more pictures of that. Yeah, some keloids might actually override your whole ear and overtaking your whole ear. They may be larger than the whole surface area of your own ear. Can you imagine that? Even both of your ears. And so, yeah, your skin will appear discolored. Like, yeah, I just showed you how it appears here. Can you see that over here, the skin appears a bit discolored? A bit discolored, isn't it? Not exactly darker. Yeah, slightly darker, a bit discolored from the normal color of your ears. In light-skinned individuals, you may see it looking, pinkish, reddish, purplish, or even brownish. So here, yeah, even in in darker individuals, it may look a bit different. Discolored, yeah, this is perfect as when you want to describe it as discolored. It looks purplish, it looks brownish, isn't it? It looks darkish. This inner one looks actually darker than the normal surrounding skin over the ear. Yep, it appears smooth surfaced, is hairless. Can you see that? There is no hair over the keloid. There is no hair over the keloid. There is no hair, and it appears translucent. Yep, it's translucent. So, over time, I mean, this helical keloidal color, it actually gradually darkens over time compared to the surrounding skin. So, I mean, if you leave it long enough, yep, the color will darken over time, even though this just looks slightly discolored, right? And as I said before, yep, when you injure the skin over your ear, it develops in a keloid in those people that are prone to developing keloids. But I mean, what other things can cause these keloids, these helical keloids, as you've seen in these pictures, other than, of course, trauma? Yeah, trauma can be from what? Yeah, from cuts, right? From pinpricks, from burns. Maybe you burnt your ear by mistake. Maybe a scratch. Maybe your ear was itchy and then you scratched it. Did you possibly pierce that? Yeah, some people actually pierce their helix, for beauty purposes. Tattoos, even. Some people tattoo their ears. Yeah, some people tattoo it. How about pimples? Yeah, you can have acne, isn't it, over your helices, and subsequently, during the abnormal scar healing process, the abnormal healing process developing, resulting in a scar, you can develop a helical keloid. How about chickenpox? Yep, chickenpox, leaving lesions, leaving scars over your ear, can develop into a keloid. And how about bug bites? Oh, yeah. Imagine if you're sleeping, maybe an insect, maybe a mosquito bites your ear. If there is an abnormal wound healing, response, and you develop a keloid, yep, those bed bugs or those insect bites, those mosquito bites can develop into, yes, a helical keloid. So let me mention them again, okay? Cuts to your helix, burns to your helix, scratches, your ear was so itchy you scratched it. Piercings, yep, some people pierce this area of the ear, the helix. Tattoos, pimples, acne that can develop over your ears, chicken pox, scars, bed bug bites, insect bites, mosquito bites. But are you scared that you can develop develop keloids from someone? Are you scared about that, my medical fans? So don't be scared, okay? Because hey, these keloids are not contagious. They're not contagious, okay? No viruses, no bugs, no bacteria cause them, okay? They are just a type of scar tissue that develops after those things that I mentioned before: the cuts, the burns, the scratches, the piercings, the tattoos, acne, chickenpox, bugs, bug bites. But how do you treat them? How do you treat these helical keloids? How do you treat them? Hey, there's so many ways of treating keloids generally, but these helical keloids, you could do steroid injections. Yeah, steroid injections into the lesion itself. But what do these steroids or corticosteroids actually do when you inject them into this lesion called a helical keloid? Well, the corticosteroid injections will reduce the inflammation and the tissue damage. So, I mean, what usually happens is that, your doctor will use a small needle to inject these steroids into the keloid. And commonly, this doctor will, schedule injections commonly between every 4 to 6 weeks. But yeah, remember that you may need up to like 4 injections or even more to shrink these these keloids. And then, of course, we all know that, corticosteroids or steroids, they have some side effects, right? And some of those side effects can include thinning of the skin over this keloid. Could it be possible that this patient had thinning of the skin, showing her blood vessels, maybe because she had some corticosteroid injections prior to coming to this particular hospital? Yeah, it's possible. I mean, it's really, really possible, and that possibly is why she has those dilated blood vessels, as you can see, over the posterior aspect of these keloids, the back of these keloids. All right? How about surgery? Yeah, of course, surgery. Surgery. Oh, yeah. Can you see that? Can you see those enlarged blood vessels? Yeah, let me just enlarge that. Can you see that? Because the skin over the scar is actually thin, so it's tense, so it's easy to see the blood vessels there. And then also, if several times corticosteroids have been injected into the keloid, yes, you may have thinning of the skin, resulting in the blood vessels being more common and commonly seen dilated in this area of the keloid. So, as I said before, how about surgery? Yeah, surgery is a viable option for treating these helical keloids. I mean, you can use, of course, we can use our scalpel blade, our surgical knife to remove these keloids. I mean, sometimes these keloids can actually even be removed, in the office. Yeah, as a day case procedure. After numbing this area of the ear or even around the ear, with local anesthesia. But if the ear keloid is large, of course, you can't do it as an office procedure, as a clinic procedure, and you may need to go, yes, to theater to have this helical keloid removed. And so, of course, sometimes, or should I say, and of course, when this keloid is removed, of course, the keloid will be sent to the laboratory, will be sent to for histology, will be sent to the histopathologist to confirm that, yes, truly, truly, it is a keloid. And to confirm that it is just another, condition that looks like an ear keloid. After removing the keloid, we need to send it to the histopathology laboratory to confirm that it is actually an ear keloid. It is actually a helical keloid. How about cryotherapy? Have you heard of that? Yeah, cryotherapy is also another way of treating ear keloids. And so, I mean, cryotherapy is a treatment which sort of like freezes the ear keloid. It freezes the keloidal scar. And so by using this extreme cold to freeze this keloid, the keloid is actually destroyed. But remember too that you may actually need several cryotherapy treatments, all right? Several. And cryotherapy commonly is repeated, repeated once every like 6 to 8 weeks until, of course, is repeated once every 6 to 8 until, of course, all of the keloid tissue is removed. So whenever you have any remnant of this keloid, of course, you may need more cryotherapy treatments. And did you know that when you apply cryotherapy, the area of the keloid looks whitish? The ear helix keloid, immediately after application of this cryotherapy, it actually looks whitish, you know, after the procedure has taken place. Yeah. So did you know that sometimes ligatures are applied over a keloid? Sometimes, yeah, over even pedunculated keloids. So when we talk about pedunculated keloids, we mean keloids that have like a stalk, but not small keloids. Commonly, a piece of thread or surgical thread is tied tightly around the base, because if, let's say, there's a stalk, The keloid has a stalk, has like a stem, a stalk. You tie the ligature, the surgical ligature, around that stalk of the keloid. But remember that you need to replace the thread every 2 to 3 weeks or until the keloid falls off. This is less commonly used, possibly commonly used maybe in village clinics. Maybe they don't have the appropriate technology to treat, the necessary expertise to treat, and so they might decide to just opt for. And if it's a small one, yeah, it's a small one, maybe, or 0.5 cm, less than 0.5 cm, you may opt to just tie a surgical ligature, surgical thread, a ligature around the stalk, of the keloid. But remember that you have to replace the thread every 2 to 3 weeks until the keloid falls off. Those are for really tiny ones, 0.5 cm, less. So, how about laser therapy? Have you heard of laser therapy? Yeah, laser therapy can also, laser treatments can also help to improve the discoloration, associated with keloids. And there are various types of laser therapies that can be carried out over keloids. You could do the pulse dye laser therapy, you could do the carbon dioxide laser therapies. Hey, some people have used pressure earrings. Do you know what those pressure earrings are called? Yeah, they're called Zimmer splints. So, for really small keloids, some people have tried putting pressure on the, on the keloids, but more commonly over, the earlobe keloids. So by putting these pressure earrings or Zimmer splints over the earlobe, it will actually help if there's a keloid around here to reduce blood flow. And so when the blood flow is reduced around this earlobe, it prevents the keloid from developing or coming back after the treatment, all right? So after you might have gone through, the corticosteroid injections, the surgery by removing the keloids, sometimes your healthcare professional will advise you to wear the Zimmer splints or pressure earrings to put pressure on your earlobe. If you have earlobe keloids, these will help to reduce the blood flow, and so that will help preventing the keloid from developing or coming back after all these treatments that you've had. But of course, remember that pressure earrings can be uncomfortable, and you must wear them for up to like 16 hours every day for 6 to 12 months for them to be effective. So, yeah, that might be a bit uncomfortable, right? Over those earlobes. So, hey, guys, my medical fans, ear keloids are really challenging to treat. And yeah, I said before, they may even come back after the treatment. Some people have tried using a combination. Generally, all of us healthcare professionals, we try to use two or more kinds of treatments to improve the results of our patients that have keloids. I didn't mention before, some people have used, steroid creams. Some people have used, silicone creams, silicone gels to help treat smaller keloids. But usually we need to use two or more kinds of treatment to improve the results, to improve the outcome, to reduce the chances of you developing a recurrence or a repeat of these keloids, right? So, hey, if you feel self-conscious about a keloid on your helix or a helical keloid or on your lobule, you can hide it, right? With certain hairstyles, with certain wigs, with certain hair weaves or clothing until you have your complete treatment, right? And yeah, I know that it can be very tempting to squeeze these smaller ones, these smaller ear keloids, but please don't pop them. Don't pop them because they're a kind of scar tissue, okay? They're not normal tissue. So actually, even if you try to pop them, there is no pus inside this, okay? There's no pus inside these lesions for you to squeeze out, unlike the pus that is contained inside a pimple. So if you try to pop this, if you try to pop this keloid over your ear, you can cause damage to your ear, right? You can cause damage to your skin, and of course, you can introduce bacteria into your skin, which can cause an infection. making the abnormal scar response even worse, right? So as I said before, you can use silicone gels, silicone creams, or even silicone, dressings. Um, yeah, I know I mentioned before about the pressure, the Zimmer splints that can be used to compress keloids over the lobule of the ear. Because, I mean, these compression earrings should be worn like 24 hours per day at least, maybe less, just slightly less. After you remove the sutures following surgery, I mean, sometimes your patients will not comply. I mean, however, I mean, regardless of whether you use these compression earrings on the earlobe or other parts of the body, I mean, we know that pressure therapy is a simple and really effective and efficacious way of handling, you know, helical keloids, lobular keloids with minimal adverse effects. I mean, some other treatments have been tried out for keloids like interferons, IFN, fluorouracil, 5-FU, and multiple other treatments. And I think we'll talk about that in subsequent live streams on some common medical conditions that we see in surgery. Um, yeah, let me just say it again. I mean, although multiple management options are available, yeah, for the treatment of helical keloids, they can be expensive, and yeah, recurrence rates, as I mentioned before, you can still have it coming back. It remains high, okay, even with all this multiple forms of treatment. So hey, try and prevent it, all right? Try prevent injury to your ear, especially if you know that you have a family history of keloids. And please, if you do have that, just avoid ear piercing. I hope you enjoyed this, my live session on helical keloids, and join me again soon. Love you, medical fans. Bye.